Many older people always keep a painkiller or an anti-inflammatory within reach. When pain appears, they take it. When it returns, they repeat. Over time, this behavior becomes automatic and is no longer questioned. The pain is relieved, but the problem is still there, and that is a key mistake. Relieving pain does not always mean taking care of the body. I am Dr. Sinclair, and I ask you to stay with me until the end, because today we are going to talk about why repeated pain is a signal, what the silent risks of frequent painkiller use are, and when that seemingly harmless habit deserves real attention. Why repeated pain is a signal. Pain is one of the body's main communication mechanisms. It does not appear by chance or whim. Its function is to warn that something is not working correctly. However, many people over the age of 60 get used to living with frequent pain and interpret it as an inevitable part of aging. This interpretation is dangerous because it normalizes a signal that should be listened to. When pain appears repeatedly, the body is indicating that there is a persistent cause. It may be joint overload, sustained inflammation, poor posture, an incorrect movement pattern, or a degenerative process that requires follow-up. The problem is not feeling pain once in a while, but feeling it always in the same place and responding in the same way every time. Taking a painkiller may temporarily relieve the symptom, but it does not change the origin. The body learns that each signal will be silenced, not addressed. Over time, pain stops being a punctual alarm and becomes a constant background noise. This process changes the person's relationship with their own body. Instead of asking why it hurts, they ask what to take. Attention shifts from the problem to the quick solution, and that delays diagnoses, corrections, and necessary care. In addition, repeated pain often becomes more complex. What begins as mild discomfort can turn into stiffness, limited movement, or loss of functionality. Not because the body suddenly fails, but because the original cause was never addressed. Another important aspect is that pain does not always increase linearly. Sometimes it remains stable for years. This reinforces the idea that it's not serious. However, stability of pain does not mean stability of the problem. Many conditions progress slowly and only manifest when the damage is already greater. Repeated pain also affects the nervous system. When a signal persists over time, the body becomes more sensitive. This can cause mild stimuli to produce greater discomfort. At that point, the problem is no longer only physical, but also neurological. Listening to pain does not mean living in fear or avoiding movement. It means interpreting it as valuable information. The body is not wrong when it hurts. What usually fails is the automatic response given to that signal. After 60, paying attention to pain is a form of self-care. Not to dramatize it, but to understand it. Repeated pain is not an enemy, it is a message. And like every important message, it deserves more than chemical silence. Silent risks of frequent use. Frequent use of painkillers or anti-inflammatories is often perceived as safe, especially when they are familiar and commonly available medications. Many people over 60 take them for years without questioning it. The problem is that the risks do not always appear immediately or obviously. One of the main silent risks is the gastrointestinal effect. Repeated use can irritate the stomach lining, promote gastritis, and increase the risk of bleeding. These effects do not always produce clear symptoms at first. Sometimes they are detected when the damage is already established. Another important risk is kidney impact. The kidneys are especially sensitive to prolonged use of certain medications. In older people whose kidney function may already be reduced, this effect is intensified. Deterioration is usually slow and silent. There is also a cardiovascular impact that is often underestimated. Some anti-inflammatories can increase blood pressure or alter cardiovascular balance. In people with prior conditions, this risk is greater. But beyond organic effects, there is a behavioral risk. the body gets used to pain being eliminated externally. This reduces the sense of urgency to modify habits, postures, or activities that are generating the discomfort. Frequent use can also mask important symptoms. A pain that should motivate a consultation becomes tolerable thanks to medication. This delays necessary medical evaluations and timely diagnoses. Another often overlooked aspect is interaction with other drugs. Many older people take several medications. The constant addition of painkillers increases the risk of interactions that may affect treatment effectiveness or safety. The problem is not the medication itself. The problem is automatic use, without reflection or follow-up. When a resource is used every day, it stops being occasional and becomes a routine. And every routine deserves to be reviewed. The body was not designed to function under permanent anesthesia. Pain has a regulatory function. Silencing it constantly has a cost, even if it is not immediately noticeable. Taking care of health after 60 means looking beyond quick relief. It means asking what is being paid in the long term for a solution that only works in the short term. The mistake of covering symptoms. Covering a symptom is not the same as solving a problem. However, this confusion is very common when it comes to pain. Many older people feel relief and assume that equals care. The body, meanwhile, continues to face the same underlying cause. When a symptom is repeatedly covered, the opportunity to intervene in time is lost. Pain stops fulfilling its warning function. The body continues sending signals, but the person no longer registers them. This mistake is especially relevant in musculoskeletal pain. A joint that hurts repeatedly is usually overloaded or poorly stabilized. By covering the pain, the person continues using that joint in the same way. Over time, the damage deepens. The same happens with pain of inflammatory origin. The painkiller reduces inflammation temporarily, but does not eliminate the stimulus that causes it. This creates a false sense of control. Covering symptoms also has a psychological impact. The person learns to disconnect from their body. Pain stops being information and becomes a nuisance to eliminate. This disconnection makes prevention more difficult. Another problem is that the symptom can change. When silenced, it manifests in another way. Stiffness, loss of strength, or functional limitations appear that seem unrelated to the original pain. The mistake of covering symptoms does not mean that pain should never be relieved. It means that relief should not be the only strategy. When relief becomes the main response, care remains incomplete. After 60, the body needs attention, not constant anesthesia. Every symptom has a context. Ignoring it delays important decisions. Taking care of the body is not always about making pain disappear. Sometimes it is about understanding why it hurts and acting accordingly. The symptom is not the enemy. The enemy is not listening to it. When to pay real attention. Not all pain requires immediate alarm, but there are signals that should not be ignored. Paying real attention means differentiating between occasional discomfort and a repeated pattern. When pain appears frequently, in the same place and under the same circumstances, it deserves deeper evaluation. It is also important to observe whether pain increases over time, spreads to other areas, or begins to limit daily activities. These changes indicate that the problem is evolving. Another key point is medication dependence. If relief is only achieved by regularly taking painkillers, the body is indicating that it needs more than symptomatic relief. Paying attention also means reviewing habits. Postures, repetitive movements, poorly distributed loads, and lack of physical preparation are often underestimated causes. After 60, the body does not respond the same way as before. It needs more preventive care and fewer automatic responses. Real attention is not dramatizing, it is anticipating. It is understanding that persistent pain is not normal just because of age. Consulting, evaluating, and adjusting habits is a form of respect for one's own body. The goal is not to live without pain at any cost, but to live with a body that functions better. And that begins when pain stops being silenced and starts being understood. Pain is not meant to be covered without questions. It is meant to be listened to. Relieving does not always mean caring. True prevention begins when you understand what your body is telling you. If you made it this far, write in the comments, "My health matters," because yes, health, that is the most important thing.